way to be friends. All right, we're going to go over hyperlipidemia. Hyper means high. Lipid means fat. Emia means, so what's hyperlipidemia? High fat in the blood. Okay, this is a problem, okay? All right, so let's talk about what we're going to see in this plaque, because y'all keep saying plaque, 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 right? All right, so let's talk about what the plaque is. What are triglycerides? I will tell you. They are 3 fatty acids linked by glycol. Okay, what are triglycerides, though? They're fatty acids. Okay, now how do you get triglycerides in your body? You eat what? It is not any of those things. Triglycerides come from excess what? What'd you say? Carbs. So triglycerides come from too much sugar, not fat. So telling all your patients have a low-fat diet is kind of stupid, but okay. So triglycerides are made from excess sugar. All right, so let's talk about sugar first. As soon as you eat sugar, what's the first place your body does, or first thing your body does with it? First thing, use it for energy, right? It goes into the cell where it's burned by oxygen into ATP for usable energy. All right. If you done eat too much, okay, like let's say y'all went to the donut shop this morning, okay, and you ate 12 glazed donuts. Do you need 12 glazed donuts for energy this morning?
Yeah.
No. So your body's going to take 2 of those and use it for energy. Where's the second place that it goes if there was too much? It's going to go to the liver, because remember, liver has your glycogen stores. So it's going to fill up that whole huge tower with sugar. Then when that starts overflowing, that sugar just sits on your liver and turns into fat. And that's what gives you a fatty liver. So if someone has a fatty liver, what diet should you tell them to have? Low sugar. Does low fat diet help? No. Okay. So what's the third place that it's going to go? It's going to turn into triglyceride. I just freaking told you. It's going to turn into triglycerides, and it just swims around in your blood. Do you understand? Okay. Now, those triglycerides can get stuck inside the vessels if you already had plaque in there. Okay. What is cholesterol? It's a wax.
I'm not wrong.
Ma'am. Okay. It is a wax. And remember didn't I talk to y'all about it last week about the braces? Did we talk about this? Y'all had braces before? Has anybody in here had braces? Raise your hand if you've had braces on your teeth. Okay. When they start to rub on your gums or on your lip, you know, your little wax that you put over the braces. You know what I'm talking about? Okay, that is cholesterol. All right. Its job is to go into your vessels, find the places that are irritated, that are angry, and plug in the holes. Okay. So when a patient has high cholesterol, that tells me what? The vessels are irritated for some reason. Now we need to find out what the reason is. Is cholesterol bad for you? No. Okay. So cholesterol, what's its main job though, other than patching up the bad surfaces? It makes up all your cell membranes. Do you need cell membranes? Yes. So cholesterol, very important. It also is a main component of your, do you need a brain? Yes. So we need cholesterol. But when someone's cholesterol goes very high, what is that telling me? There's some damage there, and I need to find out what's causing it. Now, how do we treat it in the medical field? We give them meds to lower the cholesterol that's plugging up your holes. So that doesn't make sense, does it? Okay, so, right. So you need to find out what the root cause is. What is causing so much irritation of your vessels? Do you understand? Okay, so other than cell membranes, brain growth, the wax to your braces, okay, it also is a precursor and produces vitamin D. What do we need vitamin D for? It helps to absorb calcium, and it plays a massive immunity role. Can someone please go close that door? Thank you. It plays a massive role in our immunity. Yes? Okay. Do you understand the difference between triglycerides and cholesterol? All right, let's talk about LDLs, VLDLs, and HDLs. Okay. LDLs, they tell you are, and they tell you that HDLs are, okay, all right. LDLs are, the reason that they say they're bad is because those tend to deposit where? In your vessels somewhere, right? And they're just going to kind of cause layers of junk. What is the job of your HDLs? They go grab the LDLs, grab a hold of like the ice cream scoop, the junk that's in your vessels. It takes it back to your liver, and your liver will metabolize and poop it out, right? So that's why they call HDLs the good ones. High density lipoproteins. LDLs are low density lipoproteins, okay? I don't care what your total cholesterol is as much as I care what your HDL to LDL ratio is, right? So if you have very, very good HDLs, which y'all know your labs, by the way. Okay, let's do the labs really quick just to make sure. Y'all know the rule of 50s? All right, let's do the rule of 50s. If you don't know it, write it down somewhere. I wrote it down for you, but also it helps you to write it. What do I mean by the rule of 50s? Everything goes by 50. All right, so you want your total cholesterol to be less than? What do you want to be less than 150? Triglycerides. What do we want to be less than 100? What do you want to be greater than 50? HDLs. What is the only way except genetics to change your HDLs? Exercise. Do you understand? No, I'm done. Thank you. Wait, which part? This one?
Like your total cholesterol should be less than 200.
Uh-huh. Total cholesterol should be less than? What should be less than 150? Triglycerides. What should be less than 100? LDLs. What should be greater than 50? HDLs. All right? Y'all with me? Hmm?
They like have like a specific like 147 or some bull crap, but if you know these
Yeah, this way. All right. Risk factors. The risk factors I am about to go over will be the risk factors for pretty much the rest of today. So once you can learn these, we good to go. You with me? What are some things that are going to irritate the inside of your vessels? Smoking, okay. Being old because, you know, over time you ate a lot of sugar. Yeah? Okay. Increased CRP. What's a CRP? All right, it's inflammation marker, which tells me I'm going to be releasing a lot of cortisol. What is cortisol? That's your stress hormone. And what does it do to your blood pressure? Increases. What does it do to your blood sugar? Increase it. Well, that's bad because all that sugar is going to get around all your pizza and hamburgers inside the vessels. You with? All right. A high fat diet can contribute if you're eating really bad high fat foods. I want to be very clear on that. High fat foods are not an enemy. Okay. What is good fat that you could eat that would be great for your heart? Like what? Avocados, eggs. Like there are very good fats. Any kind of actual good oils like olive oil, avocado oil. When I say high fat here, that means tons of fried foods and yeah, saturated fats and lots of pizza. Yes, things that are just very drippy. Okay. CKD. Why is that a risk factor for hyperlipidemia? If you have kidney, okay, tell me more.
Kidneys close to not working out.
All right, so how would that lead to hyperlipidemia? He's like, that's all I had. Thank you. Okay, if your kidneys aren't working, what's in your blood? Waste products. Don't you think that would irritate your vessel? Yeah. Why would obesity be a risk factor? Pressure on your vessels. That's a big one. And your diet isn't probably great at this point. Yes? Why would type 2 diabetes increase your risk? Lots of sugar. If your blood is very thick and viscous from all that sugar, what happens to your blood pressure? So now you have thick, viscous, high pressure blood going through your gut. That's going to tear them up. Yes? And that's going to tell your body something is wrong, which is going to produce tons of cortisol. And then cortisol does what to your blood pressure? It increases it even more. And it does what to your blood sugar? It increases it. You see, on round and round we go. All right, then. Why would liver disease cause hyperlipidemia? Whose job is it to make and get rid of cholesterol? The liver's job. So if the liver is not working very well, can it make or get rid of cholesterol? No. Why would stress cause hyperlipidemia? Lots of cortisol. Cortisol is where we live. Yes? Okay. All right. Why would a sedentary lifestyle cause hyperlipidemia? You're not exercising. You're not moving your blood. If your blood doesn't move, then it gets sluggish and Plus, sedentary lifestyle leads to obesity. Yes? All right. Let's talk about the complications, like what happens if you don't fix hyperlipidemia. Because how I did these are all new, by the way. So hyperlipidemia leads to atherosclerosis, which will then lead to angina, which will then lead to MI, which will then lead to... Do you understand how this works? Okay. Y'all with me? So we're going to do everything in order today. All right. So the complications of hyperlipidemia would be coronary artery disease. What is that? Coronary artery disease. So that's atherosclerosis in the coronary arteries. Where are the coronary arteries located? On the hearts. The coronary arteries are what gives blood flow to the heart muscle. How many are there? 5. That's where you hear like, oh, he got a double bypass. Oh, he got a triple bypass. That's how many coronary arteries had to get bypassed. Yes.
Could you clarify arteriosclerosis of the coronary arteries?
No, there's athero and then there's arterio.
So it's after.
Atherosclerosis is a buildup of plaque. Arteriosclerosis is the stiffening. Y'all with me?
Yes.
All right, other complications for hyperlipidemia. How could hyperlipidemia lead to a stroke? A stroke is an MI of the brain, is it not? A stroke is caused by atherosclerosis in the vessels of your brain. Yes, okay, but that's true too. All right, atherosclerosis, we already talked about that one. And then myocardial infarction. How does hyperlipidemia lead to that? Now, that's a very easy question. Okay, so the plaque blocks the coronary arteries, which cause a decrease in the perfusion and blood flow to the coronary arteries and then the heart muscle. Yeah? Okay, cool. Are y'all with me? All right, just making sure you're following the dots. Okay. All right. Let's talk about metabolic syndrome. So metabolic syndrome is a syndrome of 5 different signs and symptoms that if you don't change your life right now, you are going to have very bad diseases for the rest of your life. Do you understand what I'm saying? Oh, good. Okay. So metabolic syndrome. All right. So this is do you understand what it is and how we use it? So metabolic syndrome puts you at huge risk of developing coronary artery disease because you're about to get on that wheel. You know what I'm talking about, the wheel? The wheel that never stops. The problem leads to increased cortisol. More problems. Do you understand? All right. So the number 1 sign and symptom would be abdominal obesity. That would be greater than 35 inches in women or greater than 40 inches in men. This is often a test question for everyone in here. Okay. You thought it said years. I know. It's okay. It's okay. So, and that's why when I heard you say, I was like, I know what she meant. I knew exactly what she meant. All right. The more fat, where do you get fat on your abdomen? Where does that come from? That comes from cortisol. So that already tells me you've been living in a stress response for a very long time. All right. Number 2 sign and symptom of metabolic syndrome is hypertension, which is going to put pressure on your vessels, right? That will irritate your vessels, right? Okay. And that will cause more plaque to be able to build up. Number 3, HDL less than 40. The lower your good cholesterol is, the more your bad cholesterol can congregate where? In the vessels. Number 4 is insulin resistance. What is that? It is it's a precursor to, right? All these are like precursors to you're about to get bad diseases. So insulin resistance means when you eat sugar, your pancreas does produce insulin, but your cells are like, I see this all day, every day. All you do is eat 20 hours a day. So I'm tired of seeing it and it's not going to work anymore. You can't open the door of the cells anymore, which is going to cause your blood sugar to increase, which tells your tells your body something's wrong and makes you produce more cortisol, which does what to your blood sugar? Increases, which does what to your blood pressure? And round we go. Yes? Number 5 is hyperglycemia, which goes with the insulin resistance.
Guys, like
Oh, okay. I couldn't tell if you were saying hello to me or, okay, oh yeah, hello.
Would so like if part of metabolic syndrome decrease in HDL, would increase in HDL or increase in LDL cause it as well?
You probably will see it with that, but these are the actual criteria a patient has to meet to be diagnosed with metabolic syndrome.
Okay, so if it was like decrease or increase LDLs, that's not.
It is a thing. It definitely is a thing, and I probably will see that in this patient, but it's not part of the criteria to diagnose them with metabolic syndrome. Okay. But if you do have if you have a patient, chances are their total cholesterol is greater than 200, their triglycerides are greater than, you see what I'm saying? It probably does exist. It's just not part of the criteria. Does that make sense? Yes.
So could you have a patient that has a higher LDL, but also has more than 50 HDL?
Yes.
So that's why that's not.
You could have a patient that has a high LDL and high HDL. Okay. That's you. How high is your HDL? I was going to ask you that. I thought about you this week.
56, my LDL is 241, my total cholesterol is 314.
Okay.
If that makes sense.
Yeah. So wait, what was your HDL again?
56.
56. That's not bad. But you exercise a lot too, though. Yeah. So something up with that. Yeah, we'll fix it. Don't worry. We can fix it. We can fix anything. Okay.
Everything was normal, but his triglycerides were like 7 times It was like 500 and something.
Well, that's bad.
Like, obviously it's good.
Their blood, it comes out like buttermilk at that point. All right, we got to keep going. All right, guys, we have to keep going. What is the treatment for hyperlipidemia? First thing you're going to do is lifestyle modifications. Don't look at your papers. It's not going to do you any good. What would you tell your patient who had hyperlipidemia? Huh? All right, so decrease their sugar, their carbs, decrease their fat too, because we want to tell them not to have as many saturated fats, right? So low fat, low cholesterol diet. You want their BMI less than 25, which means they need to exercise and lose weight. Yes. What's the only way to increase your HDLs? Exercise. What are you going to tell them about smoking? Stop it. What are you going to tell them about alcohol? Stop it. Okay. What are you going to tell them if they have diabetes? All right. And how do you tell them that they're managing it? Because every person with diabetes is like, yeah, I'm doing great on this. What is your marker? Hemoglobin A1C of less than what? 6.5%. 6.5%. Okay. You're going to tell them to reduce the stress in their life. You cannot tell somebody to avoid stress. Never pick that on a nursing school exam. You cannot possibly tell them to avoid all stress. But you can teach them coping mechanisms, stress reduction techniques. Do you understand? Do we understand hyperlipidemia?